Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been feeling a bit more tired lately, and I'm concerned about my kidney function, which seems to have worsened since my last checkup. My creatinine levels are up, and I've been feeling this wheeziness at night that requires me to use the albuterol inhaler more often.
I understand your concerns. Let's take a detailed look at your current symptoms and medical history. You mentioned feeling more tired. Can you describe that a bit more? When did you start noticing this increase in fatigue?
It's been a few weeks now. I just don't have the energy I used to, even for my daily walks. I've been managing to keep up with biking, which helps a bit with my blood pressure, but overall, I feel drained.
And you've noticed your breathing has changed as well? Could you elaborate on the wheeziness you experience at night?
Yes, especially at night. It feels like I can't catch a deep breath, and I end up using my inhaler. It helps, but it's become more frequent, almost every night now.
Have there been any changes to your pain management? I see you've been on Vicodin for your back and hip pain. How effective is that currently?
The Vicodin still helps quite a bit with my back and hips, but not so much for my shoulder pain anymore. I'm also concerned about taking it for too long, and the gabapentin I started for the pain makes me too drowsy. I'm thinking about cutting it down.
We can look into adjusting the gabapentin. You also mentioned stomach pain. Can you tell me more about that?
The stomach pain comes and goes, but when it hits, it's severe. It's a sharp pain around my mid-abdomen. After some recent tests, they suggested it might be related to possible artery blockage.
It's good that you've undergone those tests. We'll keep monitoring that closely. Now, about your allergies. How are they with the new cetirizine prescription?
It helps with the runny nose and itchy eyes, but the symptoms still break through sometimes. I take it along with my other medications like valsartan, which we've adjusted the timing of to manage my blood pressure better.
I see you're proactive with your health, which is excellent. Your current blood pressure is a bit elevated at 152/72, and your labs show your kidney function has slightly declined with a creatinine of 1.5 milligrams per deciliter. Let's discuss the next steps based on your overall health.
I appreciate that, doctor. I want to maintain my activity level and manage these issues as best as I can.
Based on our discussion and the recent labs and imaging, here's what I recommend. We should adjust your valsartan to better stabilize your blood pressure throughout the day. Given your concerns with gabapentin and its side effects, we might consider tapering it off if it's not providing the benefit we need. Your kidney function will require close monitoring, especially given the elevated creatinine levels. We'll schedule follow-up blood tests in a month to see if there are any improvements or further adjustments needed. For your allergies, continuing cetirizine is advisable, but we might need to adjust the dose if symptoms persist. Lastly, regarding your stomach pain, continuous monitoring is crucial. If the pain becomes more frequent or severe, we may need to investigate further, possibly with additional imaging or a referral to a specialist. How does that sound?
That sounds like a solid plan, doctor. I appreciate you taking the time to go through everything so thoroughly.
Of course, it's important we keep you feeling as well as possible. We'll see how these adjustments go, and we'll revisit your treatment as necessary at your next follow-up. If there's anything urgent before then, please don't hesitate to contact us.
Will do. Thanks again, doctor. I feel better having this plan in place.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been really struggling with my pain management lately. I feel like the tramadol isn't enough anymore. I'm taking it more often than I used to, and I'm worried it's too much. It's mostly my back, neck, and shoulders. They just never seem to give me a break from the pain.
I understand your concerns about the tramadol. It's important to manage it carefully to avoid any complications. Tell me more about your pain. When does it typically get worse?
It's worse in the mornings and late at night, and it seems like any physical activity just makes it unbearable. I've tried over-the-counter painkillers, heat, massages. Nothing seems to work long-term.
Have you had any physical therapy or seen a pain specialist for this before?
I had some physical therapy a few years back, but it was mainly for my legs after one of my stents was placed. It helped a bit then, but I haven't tried anything recently for my back or neck.
That's helpful to know. Let's also touch on your diabetes management. How has that been going?
My blood sugar has been dropping suddenly at times. I've had a few episodes of low blood sugar recently, especially in the evenings. It's a bit scary when it happens.
Yes, that sounds concerning. We'll need to review your diabetes medications and possibly adjust them. And your smoking. Have you given any thought to quitting?
Honestly, doctor, I know I need to quit. I've cut down quite a bit. I'm only smoking a few cigarettes a day now, but stopping altogether feels daunting.
I hear you. It's not easy, especially with everything else you're dealing with. Let's see what we can do to support you better there. Now, can you update me on any recent hospital visits or tests you've had?
Well, the last time I was in the hospital was a few months ago for chest pain. They kept me overnight for observation and did some tests, but everything turned out okay. They adjusted my nitroglycerin prescription, and I haven't had severe chest pain since.
That's good to hear. It looks like the adjustments helped. I've reviewed your recent lab results and imaging studies. Your heart function seems stable, and there's no sign of aortic dilation. Your cholesterol levels are within target, but your C-reactive protein is a bit elevated, which indicates some inflammation.
So what's the plan, doctor? I'm really hoping we can find something that works better for my pain and my overall health.
Let's outline the next steps. First, regarding your pain, I believe a referral to a pain management specialist is in order. They can evaluate your current regimen and explore other options like targeted therapy or non-opioid medications. Physical therapy could also be beneficial, focusing specifically on your back, neck, and shoulders. For your diabetes, we need to adjust your medication. I'm considering reducing the dose of your glipizide to prevent the low blood sugars you've been experiencing. We'll monitor this closely. As for your smoking, I want to refer you to our smoking cessation program. They have excellent resources and support groups that can help you through the process. Lastly, I'd like to schedule some follow-up tests in a few months to monitor your progress, including a stress test, routine labs, and possibly another echocardiogram to keep an eye on your heart function.
That sounds thorough. I appreciate you taking the time to go through all this with me. It's a lot to manage, but it sounds like we have a plan now.
Absolutely. We're here to support you every step of the way. I'll have my team schedule your appointments and follow up. We'll work together to address each issue systematically.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I've been reviewing the protocol for managing sepsis and noticed some inconsistencies in how we're applying it. Have you observed this as well?
Yes, I've seen variations in the timing of antibiotic administration. It's crucial we adhere to the guidelines to improve patient outcomes.
Exactly. We should consider organizing a training session for the staff. Ensuring everyone is up to date on the latest protocol could really make a difference.
I'll arrange for a meeting with the education department. We could use a refresher course on sepsis management.
That would be perfect. Let's aim to have this in place by next month.
Now look at question 26.
I was speaking with the team about the recent increase in cases of hospital-acquired infections. We need to address this urgently.
Agreed. Have we identified any common factors among these cases?
It seems like inadequate hand hygiene could be a major contributor. Also, some of the isolation procedures are not being followed strictly.
Let's implement a stricter monitoring system and consider additional staff training on infection control practices.
I'll coordinate with the infection control team and set up workshops. We need to ensure everyone understands the protocols clearly.
Good initiative. Keeping our patients safe from further infections is a priority. Let's keep each other updated on the progress.
Now look at question 27.
I've been reviewing your recent blood tests and noticed your blood sugar levels have been consistently high. Have you been following the dietary plan we discussed?
Honestly, I've been struggling with sticking to the diet. It's been hard to resist sweets, and I'm not always able to prepare healthy meals.
It's important that we manage your diabetes effectively to prevent complications. Maybe we can look into more practical meal planning or a referral to a nutritionist.
That sounds helpful. I really need some guidance on how to make better choices easily.
We'll work on this together. Let's schedule a follow-up in a month to monitor your progress and make any necessary adjustments.
Now look at question 28.
I've been having a lot of joint pain in my hands and wrists. It's been difficult to even hold things lately.
Your symptoms sound like they could be related to rheumatoid arthritis. Have you noticed any swelling or stiffness in the mornings?
Yes, especially in the mornings. The stiffness can last for several hours.
We should conduct some tests to confirm this and start treatment early to manage the symptoms effectively.
What kind of treatments are available?
There are several options, including medications to reduce inflammation and physical therapy to help maintain joint function.
I'm glad there are options. I was really starting to worry about how this would affect my daily life.
It's good that you came in early. Let's get started with the tests and go from there.
Now look at question 29.
Can you update me on the patient with acute appendicitis in room 208?
Yes, that's Mr. Davies. He was admitted late last night with severe abdominal pain. We performed an ultrasound that confirmed the diagnosis.
Has he been prepped for surgery?
Yes, he's scheduled for an appendectomy later today. The surgical team is aware and pre-op procedures are in place.
How is he handling the pain?
He's currently on IV pain medication, which seems to be managing it well. We'll continue to monitor his condition closely until the operation.
Good. Make sure his family is updated about the surgery schedule and post-op care.
Will do. I'll speak with them shortly and ensure they have all the information they need.
Now look at question 30.
There's a new admission coming in from the emergency department. It's a case of pneumonia in an elderly patient.
Do we have the details yet?
It's Mrs. Thompson, an 82-year-old with a history of COPD. She's presenting with increased breathlessness and a high fever.
Has she been started on antibiotics?
Yes, she's receiving IV antibiotics. We're also providing supplemental oxygen to help with her breathing.
Are her vaccination records up to date?
I'll need to check that. It's critical with her COPD and current condition.
Please do, and keep me posted on her oxygen saturation levels in response to the antibiotics.
Absolutely. I'll monitor her vitals closely and update you with any changes.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Welcome everyone to this session, where we dive into the profound implications of genomic therapies on neurodegenerative disorders. We're privileged to have Dr. Helen Richardson with us, a neurologist and a leading researcher in neurogenetics.
Thank you for having me. It's an exciting time in neurology, particularly with the integration of genomic therapies that offer potential breakthroughs in treating disorders like Alzheimer's, Parkinson's, and Huntington's diseases.
Let's start with the basics. Can you explain what genomic therapies entail and why they are pivotal for neurodegenerative diseases?
Genomic therapies, broadly speaking, involve modifying an individual's genetic material to treat or prevent disease. In neurodegenerative disorders, these therapies are pivotal because many such conditions have a significant genetic component that drives their progression. By targeting these genetic pathways directly, we have the potential to not only alleviate symptoms, but possibly halt or reverse the progression of diseases.
What are some of the most promising genomic therapies in the pipeline for these disorders?
There are several exciting avenues currently under investigation. For instance, antisense oligonucleotides, ASOs, are being used to target specific genetic mutations in spinal muscular atrophy and are being adapted for other diseases like Huntington's disease. Additionally, CRISPR-Cas9 gene editing has opened possibilities for directly correcting genetic defects in neurodegenerative diseases, though it's still early in clinical development. Another promising approach is RNA-based therapies that modulate gene expression rather than altering the DNA itself. These therapies can potentially downregulate or upregulate genes implicated in disease progression.
Could you discuss a specific case where one of these therapies was implemented?
Certainly. Let's consider a recent case involving a patient with familial amyotrophic lateral sclerosis, ALS, linked to a mutation in the SOD1 gene. The patient was part of a clinical trial for an ASO designed to silence the SOD1 gene. Over several months of treatment, we observed a marked slowdown in disease progression, improved muscle function, and prolonged survival compared to historical outcomes in ALS. This approach exemplifies how targeting specific genetic components of a disease can alter its course dramatically, offering hope where only palliative care options were available before.
That's incredible. How do these developments influence the long-term management of neurodegenerative diseases?
These therapies are shifting the paradigm from symptomatic treatment to more fundamental disease-modifying strategies. Long-term management will increasingly rely on genetic screening and early intervention. We envision a future where neurodegenerative diseases can be detected and treated before significant neurological damage occurs, potentially preventing the onset of clinical symptoms.
What challenges do we face in bringing these therapies from the lab to the clinic?
There are several. First, the complexity of the brain and its inaccessibility poses significant delivery challenges for these therapies. We also need to ensure long-term safety and efficacy, which requires extensive clinical trials. Ethical considerations, particularly with gene editing technologies, are also paramount. Furthermore, these treatments might be costly, necessitating strategies to ensure broad accessibility.
Dr. Richardson, this discussion has been enlightening. What final message do you want to leave our audience with regarding the future of genomic therapies in neurodegenerative diseases?
While we are at the frontiers of understanding and treating neurodegenerative diseases, the potential of genomic therapies is immense. It's crucial for the scientific community, regulatory bodies, and the public to engage in ongoing dialogue about these technologies to harness their full potential responsibly. Continued investment in research and collaboration across disciplines will be key to overcoming the current challenges.
Thank you, Dr. Richardson, for sharing your insights and for your groundbreaking work in this field.
It's been my pleasure. Thank you for the opportunity to discuss these vital advancements. Let's all keep pushing the boundaries of what's possible in medicine.
To our listeners, thank you for joining us. Stay curious and continue supporting scientific research.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome to today's episode of In-Depth Health, where we explore intricate medical conditions with the guidance of experts in the field. Today, we're focusing on an often overlooked but significant condition known as antiphospholipid syndrome, APS. We're joined by Dr. Emily Stanton, a leading hematologist and researcher on autoimmune disorders. Thank you for joining us, Dr. Stanton.
It's a pleasure to be here. Antiphospholipid syndrome is a subject close to my heart, and I'm eager to share what we know and what we're discovering about this complex condition.
Let's start at the beginning. Could you explain what antiphospholipid syndrome is for our listeners?
Absolutely. Antiphospholipid syndrome, or APS, is an autoimmune disorder characterized by the body mistakenly producing antibodies against certain normal proteins in the blood. This can lead to increased clotting. The primary concern with APS is the risk of developing dangerous blood clots in the veins and arteries, which can lead to events like strokes or deep vein thrombosis. Moreover, APS can cause complications in pregnancy, such as miscarriage and preterm delivery.
That sounds quite serious. How is APS typically diagnosed?
Diagnosis primarily involves a combination of blood tests and clinical evaluation. Patients are typically tested for antiphospholipid antibodies after an unexplained clotting event or pregnancy complication. Confirming the diagnosis may require multiple tests over several weeks to ensure that the antibodies are persistently present, which is a criterion for APS diagnosis.
You mentioned pregnancy complications. Could you expand on how APS affects pregnancy?
Certainly. APS is a leading cause of recurrent miscarriages, particularly in the second and third trimesters. It can cause poor placental perfusion due to blood clots in the uterine blood vessels. This can result in complications such as preeclampsia, intrauterine growth restriction, and even stillbirth. It's crucial for pregnant women diagnosed with APS to be closely monitored by a healthcare team that typically includes a rheumatologist and an obstetrician specializing in high-risk pregnancies.
Now, for a more human aspect of APS, do you have any patient case studies that might illustrate how APS can impact individual lives?
Yes, I'd like to share the story of a patient I treated named Anna. Anna was a 29-year-old woman who came to us after experiencing multiple miscarriages. She was desperate for answers and, understandably, very distressed. After a thorough evaluation and several tests, we diagnosed her with APS. Anna's case was particularly challenging because she not only had miscarriages, but also tested positive for multiple types of antiphospholipid antibodies, which increased her risk of clotting complications. We managed her condition with a combination of low-dose aspirin and heparin throughout her next pregnancy. This approach is commonly used to help reduce the risk of clot formation and improve pregnancy outcomes in APS patients. Thankfully, Anna was closely monitored throughout her pregnancy, and she ultimately delivered a healthy baby girl at 37 weeks. It was a profound journey for her, filled with anxiety and hope, but her story exemplifies the importance of recognizing and treating APS effectively.
That's a touching and hopeful story. What are the latest developments in APS research that might change how we manage this condition in the future?
Recent research has been focusing on understanding the precise mechanisms by which antiphospholipid antibodies increase clotting risks, which could lead to targeted therapies. There's also exciting progress in the development of new anticoagulant drugs that could provide safer and more effective management options for APS patients. Additionally, genetic studies are underway to understand why some individuals develop APS and others do not, which might lead to preventive strategies in the future.
Dr. Stanton, it's been incredibly enlightening talking with you about antiphospholipid syndrome. Thank you for sharing your expertise and the impactful stories from your practice.
Thank you for having me. It's vital to raise awareness about APS, and I hope our discussion today helps listeners understand this complex condition better and recognize its signs and symptoms early on.